people wouldn't imagine going in and having any type of cosmetic surgery done and not know that their body's going to need to have a healing time. Our mouths are no different. They go through the same inflammatory processes, you know, if you had an injury or something like that. But most of those things can be minimized and controlled very easily, you know, with either, you know, anti-inflammatories if that can be used, or other medications or rinses or things like that. A lot of that has to do with individual patients, just like, you know, some patients in medicine heal a lot faster than others. So the more we can prepare our patients to be in good health going into something, the better they're going to heal. And so we'll talk a lot about those kind of things. As far as inconvenience goes, I think in some situations it can be a one visit, one treatment fix, and you're out the door and you're gone and it looks good. There's other things that it's going to take longer. You know, it may take some time to set the foundation and get the foundation healthy enough to have a smile enhancement done, whether it's taking care of cavities or cleaning up and helping the mouth be healthier because we're healing periodontal disease and getting that under control. So there's a lot of things that can say, hey, you know, it's not worth investing in this if the foundation isn't good. So we'll have to go through those steps. So that can take more office visits, more investment, but the longevity of it and how good it's going to look, it will far outweigh, you know, in my mind, if you're going to go through that process, do it right, because then you're going to get the success that you want. Other inconveniences might be that you have some temporaries that you might have to wear for a while. I know that I've worked on several cases where we're not only correcting the smile issues, but functional issues, and sometimes we have to wait for the body to tell us it's ready to go to the permanent restorations. That, you know, wow, my joints and my muscles feel so relaxed. My bite feels good. I'm speaking good. You know, my teeth had moved so much before that I wasn't able to pronounce things. You know, everything looks good, feels good, and then we know, okay, we're ready to take it to the final. You know, and part of during that time, patients are making decisions about, do they like the look of this? If you go to the final result too soon, big changes can be a little drastic. Because like I think about women that take their hair from really long to very short, it can be like, whoa, you know. And so if we work in temporaries, we can then together decide, okay, I like the look of that, you know, and you can become more used to your new look, because it is something that probably you'll need to get used to. But once you do, you're like, wow, I'm really glad I did this, you know, for myself. So there's some inconveniences in that way, that you have some time frame sometimes that we have to do things over. Financially, depending on what type of cosmetic dentistry you want to do, can be something as simple as a few $100s. Some cases, because of that foundation work that needs to be done, can cost several thousands of dollars. And sometimes we can do that over time. You know, we can kind of stage those things, and we'll have patients that are on this kind of 5-year plan, that I'm going to do this part to get healthy, and once we get here, this is what we're going to do for the final, you know, cosmetic or aesthetic result. And sometimes it's where the patient just says, no, I just want to do it all at once, and we do that. But we just need to sit together and say, hey, a lot of those type of cosmetic cases that I do, there's a lot of sit down and talk. Tell me what you like. Hand them the mirror. Let them look at what they do and don't like, what is possible, what's not possible. Even something as simple as lightening. When we think about lightening procedures, that could be a few $100s. It's important that a patient might know that if your teeth are very translucent, that the part of the tooth that looks kind of translucent or kind of gray on the incisal edges or the edges of the teeth, and the more body part of the tooth has a lot of color, you might get a lot lighter, but you might get more of you'll actually see the difference of that translucency in your natural tooth. So you may not be a candidate for lightening because it may not look better after than it looked before because of that. But are there some things that we can do in addition to lightening that can solve that problem? So we have to really understand what the patient doesn't like about their smile as to how can we help them to correct it. Just getting lighter doesn't always solve the problem. So